The next folder we come to is the eligible. So this folder shows broken down by different groups all of the eligibility. So we'll just quickly work our way through it just to explain what each different area is. So from the top there we have the eligible all, excluding the additional COVID-19 cohorts, and also including those as well. So this is including the high risk and medium risk patients. So moving down then, we have the different age groups. So 6 months to 2 years in a clinical risk or other risk group. We have all the 2 to 3 year olds, and then we move on to the school ages. So we have the 4 to 11 year olds, which are in a clinical or other risk group, which can be done by the practice, or the 4 to 11 year olds, which are not in a clinical risk group, which should normally be done by the school program. And then we have the 12 to 17 year olds in a clinical risk group, 18 to 64, and the new group, as it says, they're not to be included in the invitations just yet, 50 to 64 year olds and 65 plus. We have another one there for 65 plus, which includes any patients who are in an additional clinical or other risk group, because I believe some practices have been asked to prioritize in that particular way. And then we have again, just showing you different ways to look at the same data really. So the 18 64 year olds, and these are all except care homes and housebound, 50 64, 65 plus, and 65 and 65 again. And then we have the reports to show for the ethnicity as well, again broken down, care homes and housebound, and individual reports for those as well. And the next group is for care homes, so we have some separate reports for those, and then separate reports for COVID-19 high risk, and again care homes and housebound are separated in those as well. Housebound patients, just the housebound patients this time, and then the QOF patients, which is also important as well. And then the bottom couple of lists is showing you all the different groups, so by conditions, and then we've got the other as well, so carers and healthcare and social workers.